Good afternoon. I'd like to call this meeting of the Committee on Health to order. Today is Tuesday, October 22nd, 2024. The time is 1:08 p.m. This is an additional meeting of the Committee on Health, and we are located in room 120 of the John A. Wilson Building. I'm at-large Councilmember Christina Henderson, who's chair of the Committee on Health. We've been joined by members of the committee, Brianna Doe, councilmember from Ward 1, Charles Allen, councilmember from Ward 3, and Zachary Parker, councilmember from Ward 5. Today, we will consider and vote on 4 measures before the committee, 3 permanent bills, as well as 1 confirmation resolution, and we will consider and vote on each measure in turn today. The first is Bill 25-571, the Seizure-Safe Schools Amendment Act of 2024. On November 13th, 2023, Bill 25-571 was introduced by Council Members Allen and Robert White with co-introductions from Council Members Anita Bonds, Freeman, Louis George, Nadeau, Pinto, Trayon White, and Chairman Phil Mendelssohn. The bill was subsequently referred to the Committee on Health as well as the Committee of the Whole, and the committees held a joint public hearing on July 10th, 2024. In the district, seizures are the third most common medical emergency in our schools, with approximately 700 children having been diagnosed with seizure disorder. When a child experiences a seizure at school, they may appear confused, unresponsive, or engage in repetitive movements. It is critical for the adult in the room to identify the symptoms so that a child can receive the proper seizure treatment quickly and avoid medical complications. At the public hearing for this bill, we heard powerful testimony from students and school staff about the importance of teachers and other school personnel being aware of a child's diagnosed seizure disorder, able to recognize the symptoms early, and able to assist with administration of seizure medication when necessary. Bill 25-571 aims to address these goals in several ways. The committee print requires individual seizure action plans for students diagnosed with seizure disorder that provide the school with relevant details to care, including the symptoms to be aware of, the prescription, and the appropriate dosage of the seizure treatment medication, as well as the contact information for their health provider. The committee print also allows for students to self-administer seizure treatment in accordance with the seizure action plan. The print also requires that DC Health provide a seizure recognition training for school staff at least 3 times per year. Finally, the print clarifies that vagus nerve stimulation therapy, a non-medication treatment for seizures, should be included within the scope of the bill. Our committee collaborated closely with the Committee on Whole to make several changes to the bill. As introduced, I'm going to just name a few. So first, the bill as introduced required 2 staff to be trained to administer seizure medication. At the hearing, DC Health committed to adding seizure treatment to its administration of medication treatment, which 2 staff at every school are already required to complete. The committee believes that this is a comprehensive approach to medication administration more effective, and therefore we removed the separate requirement from the bill. Second, the bill as introduced required all staff and volunteers to be trained on the recognition of symptom seizures. Although the committee agrees with the importance of offering training to staff who interact with children with a seizure disorder, this universal requirement seemed overly broad, particularly when there are no required staff trainings on other common health conditions like asthma or diabetes. Therefore, the committee print makes this training voluntary. And as I mentioned, DC Health will be required to provide it 3 times per year, and each school will be required to communicate the training offerings, at the very least, to all teachers and staff who directly interact with the children with a seizure action plan. Finally, the committee print strikes the provisions in the introduced version requiring universal seizure recognition education for all students. Similarly, this provision seemed overly broad with no requirements for any other health conditions. The committee believes the proper forum for this proposal would be a broader conversation about improving the health education curriculum in DC public schools, an effort that is currently underway by the Office of the State Superintendent for Education. I want to particularly thank the students and their families and teachers who came to testify on this legislation at the public hearing, as well as the Epilepsy Foundation, who has provided helpful research and data to inform the formulation of this committee print. We appreciate all of your advocacy and our partnership to ensure that children with seizure-safe disorders are able to feel safe and supported throughout the school day. I would also like to thank our colleagues, Councilmember Charles Allen and Robert White, and their teams for introducing and championing this piece of legislation. I will also note that the Office of the Chief Financial Officer reported that this bill has no additional cost to the district. And so I will open up the discussion now on Bill 25-571. Councilmember Allen.
Thank you very much, Chair Henderson. First, I want to thank you and your staff for moving this bill. Really appreciate it and the work that you did and the collaboration, also with the Committee on Health. I think while most of us may be familiar with epilepsy as a disease or disorder, I think what we're less familiar with is how epilepsy can affect a young person in their daily life. The committee report goes into this a lot further, but I think it's worth emphasizing that seizures are the third most common medical emergency that occurs in our schools. And here in the district, there's approximately 800 children and teens living with epilepsies. A CDC study showed that when compared with students with other health concerns, students aged 6 to 17 years old with epilepsy were more likely to miss 11 or more days of school this past year. The study also noted that students with epilepsy were more likely to experience difficulties in school, use special education services, and have limitations when it comes to playing sports or participating in other after-school activities compared with students with other medical conditions. If you're a student living with epilepsy, daily life at school can be challenging, especially more so if you're not sure if the school is even prepared to address a seizure that you may experience in the future. Every student deserves a safe and welcoming learning environment, and this applies to our students living with epilepsy. I introduced the Seizure-Safe Schools Amendment Act of 2024 alongside my colleague, Councilor Robert White, because we were asking if a student has epilepsy, are students and staff ready and prepared to respond? The bill as introduced was based on model legislation that's currently in effect in 23 states, including our neighboring jurisdictions in Virginia and Maryland. Although the number of components included in the model bill differ from state to state, and as you've already outlined, the committee print helps tailor it, that model legislation, to the District of Columbia. After the bill's hearing in July of this year, I was pleased to hear from DC Health that there already seems to be a mechanism and structure in place to implement the components of the bill as introduced. And as any bill that works through the legislative process, I expect there to be changes to conform with what we currently have. Overall, I believe the committee print today makes our schools safer for students who live with epilepsy and prepares our teachers, staff, and school leadership to better respond in an event that a student experiences a seizure. Before I conclude, I do want to extend my gratitude to the public witnesses that testified at the bill's hearing, especially our student and parent advocates who live with or know someone who lives with epilepsy. A special thanks to Molly Ellis and Oliver Teneo for your impassioned advocacy. I understand they have proposed some suggestions, I think maybe even hearing about it yesterday, to improve the committee print. So I look forward to when the committee of the whole marks this bill up again. We can see if those suggestions make sense to be able to add in as well. I want to thank the Epilepsy Foundation for their advocacy as well for their partnership. And lastly, I want to thank my own Ward 6 State Board of Education Representative, Brandon Best, who advocated for this policy at the state board and led the state board to a resolution helping support the council and this legislative effort. So thank you, Chair Henderson, for the work that went into this, and looking forward to supporting it today.
Thank you, Councilmember Allen. Any other? Councilmember Parker?
Thank you, Councilmember Henderson. I want to echo much of what Councilmember Allen said, but also to offer thanks to him as well as Councilmember White, Robert White, for introducing this important legislation. And I think this is a great example of how the council can continue lifting up the great work of the State Board of Education. As was mentioned, this was part of a discussion and hearing an ongoing debate there at the state board, and they did offer a resolution and it turned into legislation. And as a result, our young people are going to be even more safe in our schools. So I think it's a win for the district. Thank you.
Thank you. All right. I will now move the draft report and committee print for Bill 25-571 with Steve for, or I'm going to move those both in block with leave for staff to make technical changes. All in favor?
Aye.
Aye. Any opposed? Okay. Let the record reflect that the ayes have it and the measures passed unanimously. All right. Bill 25-672, the Radiation Protection Act of 2024, was introduced on January 26, 2024 by Chairman Mendelson on behalf of the mayor and was sequentially referred to the Committee on Health and the Committee on Transportation and the Environment. On September 17, 2024, the bill was re-referred to the Committee on Health with comments from the Transportation and Environment Committee. The purpose of Bill 25-672 is to strengthen the district's protections of residents and visitors from potentially harmful effects of radiation. Current district law regarding the regulation of radiation are outdated and insufficient, and DC Health needs a clear modern-day mandate to oversee frequent used forms of radiation and promptly take enforcement actions to protect the public health and safety. The district's ability to regulate potentially harmful sources of radiation is critical to protecting public health, particularly in healthcare settings. Radiation machines and equipment are broadly used to diagnose health conditions and conduct research. Although these uses are largely beneficial, high exposure or frequent exposure of radiation can have an acute and long-term health implications. Specifically, this bill requires the mayor to regulate ionizing radiation, which includes X-ray machines and CT scanners. Although the executive has been regulating ionizing radiation since the 1970s through federal authorization and regulation, this authority has never been codified into district law. The bill also authorizes the mayor to regulate non-ionizing radiation, which includes MRI machines and ultrasound equipment. This is most significant policy change in the bill. Currently, DC Health would need to request the authority from the Food and Drug Administration to enforce any actions against handlers of non-ionizing radiation equipment. The committee print makes significant improvements to the bill as introduced. First, it aligns the licensing, certification, and registration requirements for medical radiation health professionals with the Health Occupation Revision and General Amendment Act of 2024, which the council passed earlier this year. DC Health had drafted this bill prior to the HORA being passed, and therefore the requirements in the introduced version were duplicative and in some cases conflicted with the HORA. Second, the print narrows the executive authority regarding non-ionizing radiation to focus solely on equipment used in clinical healthcare settings. The bill, as introduced, was written very broadly to include telecommunications technology, cell phones, and even microwaves. Third, the print requires the types of record-keeping documents and variance applications the mayor may require from the handlers of radiation products. Fourth, the print enhances the provisions related to the enforcement by the mayor or the attorney general, ensuring that the executive can act swiftly when there is immediate threat to public health, while also ensuring due process and procedural safeguards. Finally, the print makes several other drafting improvements, including clarifying how this legislation interacts with the Solid Waste Facility Permit Act of 1995. Taken together, the committee's changes enhance the bill to broadly ensure the protections for the public against radiation and to ensure that it's a feasible and transparent enforcement of the requirements of this act by the executive. I will now open the floor for any discussion on Bill 25-672. All right. Hearing none, I will move the draft report and committee print for Bill 25-672 in block with leave for staff to make technical changes. All in favor, say aye.
Aye.
Let the record reflect that the ayes have it and the measure has passed unanimously. We'll move on to our third bill, which is Bill 25-759, the Child Behavioral Health Services Dashboard Amendment Act of 2024, which was introduced on March 28th, 2024 by Council Members Parker, Fruman, Robert White, Allen, Bonds, Gray. It was co-sponsored by myself. The bill was referred to the Committee on Health on April 2nd, 2024, and the committee held its public hearing on July 11th, 2024. Bill 25-759 would address significant challenges in accessing behavioral health information and services for children and youth in the District of Columbia. District children and their families are facing immense challenges. According to the 2021 Youth Risk Behavior Survey System data from the Office of the State Superintendent of Education, 18% of DC high school students reported seriously considering attempting suicide. Further, 36% reported feeling sad or hopeless. The data has revealed that 67% of district high schoolers were struggling with substance use. These issues are worsened by the difficulty families encounter in accessing timely and specialized behavioral health services for this age population. While the district has many available behavioral health services for youth, the current system is fragmented and difficult to navigate. Providers maintain their own websites that are not always user-friendly for families, caregivers, or youths themselves. Additionally, it is challenging to find specific information about the types of populations served by these facilities, such as youth experiencing homelessness, youth in custody of the Department of Rehabilitation Services, or victims of gun violence. This lack of clarity can lead to confusion and delays in care. Bill 25-759 requires the development of a publicly accessible behavioral health services directory and dashboard overseen by DC Health. The directory and dashboard would consolidate vital information on available services across the district, and the dashboard would include real-time data on service capacity and eligibility requirements. By centralizing this information on an easy-to-use platform, the bill aims to streamline access for care for children, youth, and their families. The committee print made several changes from the introduced version based on testimony and conversations with advocates and the executives. First, the committee print locates the directory and dashboard within DC Health, which already hosts the online LinkU resource and e-referral platform. Housing these resources with an existing LinkU platform avoids the unnecessary costs of creating a new platform, as well as leverages the LinkU's reputation and audience. In 2024 to date, almost 24,000 users have already accessed this service. Second, the committee print requires DC Health to include behavioral health resources through the DBH School-Based Behavioral Health Services Program in the directory. This addition responds to testimony during the hearing, as well as longstanding feedback from students and caregivers who have struggled to access information about school-based mental health services. Third, the committee print creates a two-stage implementation process for the dashboard. The first stage involves creating an online directory for behavioral health services, which can be developed more quickly and at a lower cost. The second stage focuses on establishing the dashboard by September 30th, 2026. This dashboard would provide critical data on psychiatric beds in hospitals that serve children and youth. The committee believes that committee print for this legislation greatly improves access to behavioral health information for district youth and families. And I want to thank our colleague, Councilmember Parker, and his team for introducing and championing this important piece of legislation. I will now open it up for discussion. Councilmember Parker.
Thank you, Chairperson Henderson. Earlier this year, I introduced the Child Behavioral Health Services Dashboard Act of 2024 to create a publicly available dashboard of behavioral health services in the district to ensure a system of care for children, youth, and their families. Although such a dashboard is relevant to solving a host of problems, this legislation came from discussions with child advocates about how to tackle and take proactive steps to address some of the root causes of truancy and absenteeism in district schools. On paper, the district has a system by which we intervene with students who are not showing up to school and refer them to services that could help them confront challenges in their families' lives. In practice, though, there are often substantial delays between a referral for behavioral health services and a child actually receiving needed services. That delay is partly attributable to the fact that families often have to do a lot of work to reach out to multiple providers to determine whether they provide the needed services and whether they even have availability. This bill solves that problem by creating a one-stop shop, a publicly available dashboard of child behavioral health services where this information is available in a single location to accelerate and simplify the process of finding services for children. I am grateful to you, Chairperson Henderson, and your team for your work to strengthen the bill and the partnership of our health agencies to ensure that the idea can be implemented at a reasonable cost. Thank you.
Thank you, Councilmember Parker, and I look forward to your partnership to fund this piece of legislation. Any other comments from colleagues? All right, hearing none, I now move the draft report in print for Bill 25-759 in block with leave for staff to make technical changes. All in favor, please say aye. Aye. Let the record reflect that the ayes have it and the measure passes unanimously. Our final measure today is PR 25-959, which would reappoint Carla Seals to the Board of Respiratory Care as a respiratory therapist licensed to practice in the district for a term to end July 17, 2026. Ms. Seals has worked at local DC hospitals for the entirety of her career as both a lead and staff therapist. She is currently the lead therapist at Bridgepoint Hospital and has worked there for over 20 years. Ms. Seals received an associate in applied science and respiratory care from UDC and has a bachelor's degree in healthcare administration. She's a Ward 5 resident. I now open the floor for any discussion on this nomination. All right, hearing none, I move the draft report in committee print in block with leave for staff to make technical changes. All in favor, please say aye. Aye. Let the record reflect that that nomination was confirmed unanimously. This concludes today's committee meeting. The committee will hold its next public roundtable, so oversight roundtable, on Monday, October 28th at 11 a.m. We will discuss the oversight capacity and quality of inpatient psychiatric facilities and the continuum of behavioral health care here in the District of Columbia. With no further business before the committee, the time is 1:28 p.m. and this meeting is adjourned. Thank you all.